So as we near the final lessons in the series, we're going to talk about healthcare informatics. And this will be wrapping up step 5 and transitioning into some special topics and summary sort of aspects where we'll put all the evidence-based medicine components into practice. But what we're going to talk about now is how do you go from the information you collected specifically with your patient-rated outcomes and all your other documentation you do via step 5, where you're evaluating the effectiveness of your interventions and the process, and turn that into information that you can continually use to learn and grow. So our key points and objectives here is first and foremost is going to be the idea that if you routinely, systematically, and comprehensively document patient care, then you'll have the information that you will need for making these decisions. And we'll also talk about this data to wisdom continuum as far as how this occurs in real life, and then talk about different forms of collecting and managing data. So when we look at the term informatics, basically all this is the art and science of turning data into information. We talk about how we live in the data age, and that is very true. There's all sorts of amounts of data coming at us and being created daily. There are some stats in your textbook that talk about the number of clinical trials that are being registered at record pace, and the ability to manage all of this data that's being collected, both from clinicians as well as researchers, and then turn that into usable information is the role of informatics. We have medical informatics now, which focuses on using information technologies within the healthcare system. Basically, medical informatics focuses on all areas within medicine, including just simply the mechanics of medical application in the healthcare system, specifically using that information to try to create policies and procedures, whereas healthcare informatics is a subset of medical informatics that is now focused on the use of data and information to support efficient and effective patient care. And so we're really most interested in healthcare informatics for our point, but there is use for medical informatics and just informatics in general throughout all different aspects of healthcare. Right. So moving on now then to this idea here of the data to wisdom continuum. And so what this is it talks about the flow of data and how it gets used. So you start with data, and data is just simply the raw numbers. Basically, all of these patient-rated outcomes and all of the different lost time data and everything that you've been documenting and keeping over the course of time. Number of patients, number of injuries, number of exposures, all that is data. And if you just look at it in its raw form, you really have no sense of what this means because it's just too random, too large to comprehend. And so the next step in usefulness of data is to create that into information. And that is taking the data and start to do some interpreting of that. That can be doing some of the mathematical equations that we talked about as far as getting injury rates or comparing two groups or looking at the effectiveness of those interventions where you're starting to compare the two groups, some that have received the intervention and some that have not. And so you start to compile or take the data and manipulate it into a way that becomes useful. From there, you create what is termed knowledge. And this is the idea that once you have the information that you need, you start to create working theories associated with that information. And so you can take that and say, well, I'm seeing this trend, and therefore the plan is to then go ahead and implement this procedure or use this intervention program. And after that, the next step then is to wisdom, which is simply the ability to use this knowledge at the right place and time. Kind of this idea of going through this process without thinking, because you've already taken the data, you've formed it into the information, you've created the policies, and now you know when and how to apply it. The next step to talk about is the process of this and your role as what has been termed a knowledge worker. The idea here that in order for healthcare informatics to truly be useful, it requires large amounts of data, and so every clinician has an obligation to be part of this data and information time period. And so as such, all clinicians are these knowledge workers, creating data and information to then build knowledge. And so it starts with this idea of being a data gatherer. And so this is using your documentation in a way that allows for useful data to be created. And so in order for that to occur, documentation needs to be routine, systematic, and comprehensive. What that basically means is, first and foremost, you have to actually be doing the documentation. And there are legal and ethical reasons to be doing documentation. But just as important, if not more important, is the data and knowledge that can be created from routinely documenting what you are doing so that you can use that information in the future. It needs to be systematic, so that way we can make comparisons. So if we're doing a documentation procedure, or we're checking in on things, if we're using similar time periods, similar methods, or even better yet is the exact same time period or exact same methods, it allows for those group comparisons that we've been talking about. And so creating a systematic method where maybe every week you do reassessments of all patients, and so you go through and your routine documentation and your it creates then a systematic approach where each week you're going to go through that routine re-evaluation. And then finally, it's got to be comprehensive in nature. And this is the idea of incorporating some of those patient-rated outcomes, as well as health-related quality of life scores, things like that. So that way we're not just assessing our basic clinical derived measures, but getting an overall view of the effectiveness of our treatment in reaching those goals. Next on the level of being a knowledge builder is being an information user. This idea here then that you can take information, right, from other users as well as yourself and start to create some of those theories that we talked about previously. And so the process of evidence-based medicine is simply the process of being an information user. Lastly, talking about types of records, electronic medical record, electronic health record, and personal health record are often used interchangeably, but there are some minute differences that are worth talking about. The electronic medical record is simply your own internal documentation system, right? So it's single entity with a focus on a single disease or episode. The electronic health record then now is a combination of multiple records from multiple identities, but is still focused on a single episode of disease. So it's the idea that in the electronic medical record, that would be all of your documentation regarding the injury that happened at your clinic. And the electronic health record now is the idea of trying to combine that with multiple clinics. So if they go to the physician, your documentation and their documentation would both be put into this electronic health record where both groups would be able to see it, but only the creator group would be able to would be able to then edit what they created. The personal health record is a new concept coming on, and this is owned and created and maintained by the patient. And so the patient would then create their own record and would invite practitioners to put information into their own record that could then go across multiple encounters, multiple types, but would be comprehensive over the lifetime of this patient health. So all the practitioners that the patient would go to for all of their different conditions would then filter their information into this personal health record that could then be shared with any new provider or new treatment team. And so the idea here is if we're routinely, systematically creating these data points that we can then use later to solve these complex and clinically meaningful questions, we're starting to use informatics in the way that it's intended. This idea of the data to wisdom continuum, where we move from data to information and then knowledge and wisdom as far as the ability to apply data, is the most important part of healthcare informatics. And the EMR and the idea of the clinician as a knowledge builder using the EMR is how this can all be accomplished.